Here is something that should terrify you. Testosterone levels in young men in their prime, ages 15 to 39, have plummeted by 25% in just 16 years. We're talking about a drop from 605 to 451 nanograms per deciliter between 1999 and 2016. And ladies, we are not off the hook. Your testosterone drops by over a quarter in just 1 decade of midlife. It's not just about sex drive, though. It's about your vitality, your relationships, and frankly, the quality of your life. So let's talk about what's really going on. Hi, everyone. I'm Dr. Tara Scott, your hormone guru. And today in this live, we are going to be diving into one of the most misunderstood relationships. So if you are just tuning in to live today, we're starting out by talking about testosterone and libido. Now, I know what you guys are thinking, that testosterone is just for men. Well, it's not just a guy thing, right? It is also very important for women as well. And this hormone, testosterone, is absolutely critical for not just men, but also women. I'm talking about testosterone for those of you that are just tuning in. So what you need to understand is, how does it work with your libido? How does it transform your life, your energy? And yes, it also has to do with what's going on in the bedroom. So here's the problem. There's a lot of misinformation out there about testosterone and libido, and these myths are running wild. So the first thing my patients think of that testosterone is only a male hormone, but that's not true because it's also important for women. Our testosterone comes from not so much the ovaries as much as peripheral conversion in your muscle and fat from the adrenal gland. So it's not just about mood. It's not just about libido is what we think, and sex drive and sexual function and your libido, and it has to do with a lot of things. So libido is also for women influenced by hormones, psychological factors, stress, relationship, family of origin, what you're thinking about libido and sex and how you were brought up, and did you have any trauma? I mean, there's so many things that really do it. And here's the thing, I've seen patients with normal testosterone levels who have no libido. So it's not always the testosterone level that affects your libido. And there's others that have low levels of testosterone and have normal libido, or normal libido and low levels of testosterone, and vice versa. So it's a very complex web. And the other thing is that people still I'm still getting told by people that they went and asked for testosterone. One patient told me that their provider told them that testosterone would cause cancer. That's what I heard last week when I saw a patient. And they think it's dangerous because of the misuse. Now, testosterone is regulated like a narcotic, right? I have to have my DEA number to write a prescription for testosterone. You can only write 6 months. You have to see a patient. There's certain things, but it drives me crazy when we're told that, first of all, that it causes cancer. That I still had a patient last week tell me that, right? So when it's monitored, when it's prescribed properly, we can give testosterone to women. Is it off-label? Potentially. Does that mean we can't do it? So we can talk about a lot of other questions, but I just wanted to start with that one little bit.